Now we will start the 2-minute lightning round. Azita?
Good morning, everyone, and welcome to the University of Washington School of Nursing. First, I would like to express my gratitude on behalf of School of Nursing for being a part of this very important endeavor. And I wanted to, just as I was listening to all our amazing panelists today, who very eloquently remarked the importance of really, paying attention that the future of nursing will be very different from what nursing is about currently. And as I was listening to them, I think that it dawned on me the urgency that the academic nursing needs to really catch up and keep up with a pace that the changes that are happening around us so rapidly, so that we cannot anymore take 3 years, 4 years to revise our curriculum. We need to be much faster and much more agile and much more nimble to really respond to the changes that are happening around us. We know now that the nurses that we are going to prepare, they need to embrace the disruptive innovation, the advancement in technology, using them as tools to facilitate their knowledge, their caregiving, and we also need to very deeply and strongly pay attention to foster the next generation of nurses to really focus on population health, determinants of health, and also really, thinking critically and being more aware of our biases, of the power structure, of the diversity of our population, and so forth and so on. So I think that that gives us a lot of also opportunities for the future. So I'm not very worried about the future, because I think that the technology will help us to facilitate the knowledge acquisition to our students so that we can have more space in our content to focus on those very, very important areas of population health, community-based focus, and also other aspects that were brought up today.
Thank you, Azita.
Oh, okay, thank you.
Okay, Michelle.
Yeah, great. Hi, my name is Michelle Trosit. I'm the Clinical Effectiveness Officer for EBSCO Health, past president of the National Academies of Practice and co-founder of Missing Logic. Thank you to the committee members for the opportunity to provide public comment, and to my esteemed colleagues on today's panel. I knew this would be the highest energy town hall. Health equity means all persons deserve care that is evidence-based to decrease care variability across our great nation. And to decrease that variation of care, we need innovative technologies that are simplified and provide meaningful clinical decision support and shared decision making at the point of care. Second, the National Academies of Practice is a key stakeholder to the Office of the National Coordinator, and NAP represents 14 different health professions. And we have advocated that to decrease clinician burden and leverage the best of technology, that all health professions need to be a part, and we need to have an interprofessional, person-centered design within electronic health records and other mobile devices. Third, many of the challenges we face regarding complex health and social needs are being misdiagnosed as problems rather than polarities to manage. We need competency development in our profession to differentiate between problems to be solved and polarities that require management. The concept of managing polarities is not new. The Center for Creative Leadership identified that leveraging and managing polarities is a top core competency of leaders. The theme of this town hall is a crux polarity, managing high tech and high touch. It is not moving from one to the other. It is an interdependent pair in and of itself. This was called out in the HIMSS 2015 Tiger Leadership Imperative Report when the polarity thinking model was introduced as a way for nurse leaders to recognize that we must support simultaneous action to advance technology and practice. Lastly, I applaud your call for collaborative practice models. In the last town hall, it was identified that while we have models around value-based care and complex care as an example, it is challenging to scale them and sustain them.
Thank you, Michelle.
Thank you.
Mary Jo?
Hello, everyone. My name's Mary Jo Jurdy, and I represent our over 23,000 nurses at United Health Group. I lead the Center for Clinician Advancement, which supports, again, the 42,000 clinicians we have, but again, the 23,000 nurses. So that's pretty large. I have the opportunity to bring forward different initiatives for our clinicians and specifically our nurses. United Health Group is a distinctly diversified health system and well-being company. It's headquartered in the United States and actually a very large increasing presence globally. Our nurses support over 143 million consumers within our Optum and United Health Care lines of business. Our core competencies are clinical expertise, advanced technology and data, and health information uniquely enables us to meet the evolving needs of our changing healthcare environment. We extend our collective mission and aspirations of the future of nursing's goals for 2030. Our request of the committee here is to consider the four following recommendations. 1, practice expansion. Thinking of and advocating for the full scope of practice in all states to leverage nurse practitioners to deliver high-quality primary care at scale, including underserved communities. Yes. Also, recognizing and supporting the key roles that nurse practitioners play in long-term care settings serving the elderly and those with complex needs. Our second recommendation, multi-state licensure. Influence policy change to allow for nurses to have one multi-state licensure to the ability to practice in all states and territories. Our third recommendation, academic preparation. Prioritize academic preparation so all nurses are prepped to care for the holistic needs, including public health and social determinants. Embrace the use of data analytics and improve understanding of the business side of healthcare. Assure formal training regarding trauma-informed care and adverse child experiences.
Thank you, Mary Jo.
Thank you.
Kathy Mertens?
My name is Kathy Mertens. I am past president of the American Academy of Ambulatory Care Nursing and associate chief nurse at Harborview Medical Center here in Seattle. As care delivery migrates from hospitals and clinics to homes and community settings, the future of nursing must support technology development and integration across locations and teams that include individuals, their families, and their caregivers. Digital services lift many barriers: time and distance, social determinants, and provider access. Evidence shows positive outcomes with many technology-enhanced interventions. Ambulatory care nurses are well positioned to deliver this connected care to individuals and populations in these diverse locations. Professional nursing is essential given the volume of care and educated needed to manage, interpret, and analyze data and integrate technology. We see emerging care models incorporating virtual care tools and complex health data shared through wearables, sensors, and digital tools that impact the timeliness and scope of data. Population health data allow nurses to use proactive approaches for promoting health and preventing disease. RNs now track and monitor the health of individuals within a population, not just those who seek care. Such advancements require data collection from multiple sources, analysis, and risk segmentation. Challenges include data availability, integrity, and interpretation for action, or simply access to technology for those individuals most in need. As the committee charts nursing's path for the next 10 years, please consider the following. Advocate for technology development and integration into care, including artificial intelligence to support clinical decision-making, care coordination, and population health approaches. Champion data standards and their collection. Train nurses and executives in population approaches and technology-enhanced interventions.
Thank you. So we have a very engaged live webcast audience as well, and I'm going to ask Carrie to read a comment or two from the live webcast.
Sure. Lindsay Hughes says technology can be a beautiful thing, and I believe fully that nurses need to leverage it intelligently to improve care. However, I want to also caution that we must always take care not to delegate our nursing judgment to Siri. Our skill to holistically consider the person and their needs in context of their environments, families, and communities is something we have to bunker and protect. It's what makes us nurses. But as a tool, I love the examples I'm hearing. Another online viewer says, why aren't we using the much more useful term social determinants of health equity versus the rather status quo term social determinants of health? Why aren't we killing forever the outdated and unhelpful message to our nursing students that they have to get at least 2 years of inpatient med-surg before they go on, yes, go on, to community, public, or population health nursing? Why aren't we stopping the practice of educating nursing students to be agents of social control, instead to be agents of social change? Also, thank you for the refreshingly honest and necessary presentation and perspective from Kenya Beard.
Thank you to our live webcast audience. Bridget Chandler.
Good afternoon. My name is Bridget Chandler, and I'm a late-in-life recruit to the nursing profession. I left a rewarding executive career to work more directly with people who are also committed to social justice. I began my education at Seattle University, and am now here at the University of Washington completing my DNP in family practice. I now work as a school nurse. I serve children and families from some of the communities in our city with the highest unmet basic needs. This is ground zero for redressing the suffering from health inequity born of systemic racism and bigotry in this city and country of extraordinary wealth. We school nurses are particularly well positioned to help advance our shared goal that everyone have a fair and just chance to a healthy and happy life. Nurses are in schools to support academic achievement because, duh, sick, hungry, insecurely housed kids are not ready to learn. School nurses have the potential to establish and nurture safe and trusting relationships that come from the day-to-day caring, contact with children, and respectful partnerships with teachers, school staff, community organizations, and families. High touch indeed. School nursing is a vastly underutilized resource in improving individual, family, and community health. This country needs more nurses in schools and more nurse practitioners working at the full scope of their practice in school-based clinics, serving each child on the sole basis of their humanity. A personal passion of mine is to increase our nation's health by attracting people into nursing who look like and come from the communities we serve. In the coming year, I'll partner with science and IT faculty to harness high-tech tools, ostensibly to grow kids' science and health literacy, but actually to engage in stealth maneuvers to show kids just how cool nurse scientists are. I'm curious about other models of school nursing professionals and science and IT faculty working together, and I encourage the Future of Nursing Committee to take this potential alchemy into consideration in your important work.
Thank you so much. Katie Johnson.
Right here.
Katie.
Hi, Katie Johnson. I'm going to follow up on that great example for school nursing. And I'd like the committee to consider the many lessons in our preschool through grade 12 care of children in school by nurses, so that can inform the Future of Nursing report. So we work we share the healthcare arena with everyone from unlicensed teachers and the school staff out on the playground to medical providers. We work at the intersection of health and education, and of course education is a social determinant. We are models of interdisciplinary teamwork for our children who need special education services, the nurse, the teacher, the parent, the child, the OTPT, psychologists, counselors, the community come in to help us understand what that student needs. We are holistic, student and family-centered care, providing true population health. So we take care of kids who are well, and we also take care of kids from every single clinic in the most advanced medical center. And with a nod to high tech, I would like to report to you that the National Association of School Nurses has developed a nationally standardized data set. We're using big data to better understand student needs and the resources available to meet those needs. So as we move to value-based care and healthcare, I would like us to look at schools as the nation's best-kept secret and as a community hub of healthcare that's untapped for its potential. With the application of policy and technology to optimize child and community health, using school nursing as an exemplar. Thank you.
Thank you. Okay. School nurse did it. Okay, Robin.
Hi, I'm Dr. Robin Evans Agnew. I'm an associate professor of nursing and healthcare leadership at UW-Tacoma. I'm making these comments on behalf of the Public Health Nursing section of the American Public Health Association. Public health nursing practice lies at the nexus of this Future of Nursing Committee's goals. Right? We are systems-savvy practitioners. We negotiate horizontal systems of community members for advancing well-being. And we advocate inside vertical organizational systems for policy change. It is in understanding these systems that we are ideally positioned to diagnose and transform problems through emancipatory practice and policy change. Make no mistake. These problems are not merely system problems. These are capitalist system problems that maintain class struggle, racist pipelines, and gendered oppressions. The future of nursing will depend on the transformative leadership of public health nurses who understand community context and emancipatory practice, who are recruited and funded on par with acute care nurses, who have sustained resources to collect high-touch community data, who are trained beginning at the baccalaureate level in the politics of protest, resistance, and interdisciplinary collaboration, and who have a clear-eyed understanding of the vast challenges ahead of us to achieve our goals of health justice, reproductive justice, racial justice, environmental justice, restorative justice, reparations, and gun control, finally, in this country. There's a blind spot in what we are doing. But do not lose hope. Almost a third of the young students that I teach, I see an interest and a passion in the sorts of nuanced listening, grounded data collection, and empowerment pedagogies so necessary for advancing the well-being of populations as public health nurses. They just need a level playing field. Thank you.
Thank you, Robin. I want to encourage those who are not going to have the opportunity to come to the microphone. I'm sorry there were so many that signed up today. To please give us your comments because the committee is interested in every single word you have to say, believe me. So give it to me or some of my colleagues here. Do we have any of the students? Are you one of the students? Okay. So, and you're one of the students? Okay, so I'm going to put you up. You go next. Jerry, thank you. And thank you for being so brave. We really appreciate that. You'll do great. You'll do great. Okay, go ahead, Jerry.
Hello. Good afternoon. It is great to see a familiar face. And it was amazing listening to the speakers. My name is Jerry Cercato. I'm an LPN for 3 years, working at a dialysis center. With the retirement around the corner for some, are there partnerships online between current employers and the returning students who seek to continue the pathway of the nursing profession? I only ask this because my prerequisites expire this September, including my 4.0 in statistics, as well as receiving seven rejection letters applying the traditional way. Nevertheless, I will not give up, and I'm thankful for this open session. And I will continue the dialogue in person and on LinkedIn, #Future of Nursing 2030.
Jerry, thank you. Okay, let me see. Let's do Jackie. Jackie, okay.
Hi, I'm Jackie Levin. I live in Port Townsend, Washington. I'm a nurse entrepreneur.
Can you stand closer to the microphone, please?
I'm a nurse entrepreneur, and I am an advanced practice holistic wellness nurse and coach. I'm also the patient advocate at my critical access hospital and the chief kvetch on getting more wellness programs going there. These are my concerns based on what we heard this morning. Communication through technology will never succeed until human-to-human communication succeeds. And I see that every day as I hear from patients that had difficult conversations, rude conversations from health professionals that I know were stressed and overwhelmed. So one of the roots to that is my trainings in mindfulness and compassion to bring that more into the workplace. I'm greatly concerned by all the Vocera technology I'm seeing around nurses' necks, that we have a lot of radio waves now infiltrating healthcare systems. We got rid of smoking in public places. We may have to get rid of that eventually. I think we either need to bring in the protective devices, but we also need research on what the damage will be from radio waves. I would like the ICD-9 to also include and research the return on investment of non-pharmacological interventions by nursing at the bedside as well as nurse entrepreneurs and in the clinics. Non-nurse coaches are being utilized by organizations more than nurse-trained health coaches. We need to promote nurse coaches to do this work and will advance population health. And lastly, thank you, Dr. Beard. Racism and structural racism is 400 years too long. It is time for white nurses in our organizations and in our communities to begin addressing that. Thank you.
Thank you, Nicole. Nicole, yeah.
Hi, everyone. My name is Nicole Viano. I'm a 23-year critical care nurse who has now shifted into holistic care, and I'm an integrated nurse coach, board certified. And what I'm seeing is that we have lost track of prevention of disease. So I really wanted to bring that to the committee's attention, that disease prevention could save so much money, yes, but also help people much more enhance their health and well-being. Also, I have moved to a rural area from living in a big city, and what I have noticed is that there is a lack of connection for nurses in rural areas. So I just want to bring that to the attention of the committee to use data to connect people who are on the periphery and not working in huge environments. So allowing them to come to the surface. And also supporting small businesses that are led by nurses and enhancing their ability to really make a difference in the community. And as I look around this room, I'm so hopeful, and I thank everybody for being here.
Okay, Catherine.
Good afternoon. My name is Catherine Calder-Calisi.
Speak into the microphone, thank you.
My name is Catherine Calder-Calisi. I'm a nurse can I hold
It's on.
I'm too tall for that.
Good.
I am a nurse practitioner, faculty member at the Massachusetts General Hospital Institute of Health Professions, researcher, consultant, and wellness coach. I am pleased to be here to share some testimony regarding how creating a culture of wellness in healthcare would position nurses to empower our society towards well-being. It has been said that oneself will be the doctor of the future. 40 years of research clearly demonstrates that self-care, such as lifestyle behavior changes, meditation, and stress awareness, impacts well-being and the manifestation of disease. Take, for instance, mental illness. Could one's lifestyle practices of getting improved sleep, daily exercise, and mindfulness exercises completely change one's perception of their well-being? A non-traditional approach of self-care could completely eradicate the traditional prescriptive treatment for anxiety, depression, and many other conditions. Research has also demonstrated a 40% reduction in the utilization of healthcare after such self-care and mindfulness trainings. Nurses and physicians are burdened with exhausting levels of stress in their daily practice. Teaching them various skill sets, including mindfulness practices, to break out from their patient assignment, to slow down for a few minutes, can allow for the refreshment of purpose, focus, and tasks. Creating a culture of well-being in the clinical work environment will allow for the active implementation of self-care and will enhance resiliency skills. My work has demonstrated that creating wellness breaks for nurses to attend a simple spa-like environment fosters less work-related stress and anxiety. Providing a drop-in session in a central location allows for the most participation.
Thank you so much. Sorry. Okay. Did my other student want to come down? I know you're here, but there was one more. Do you want to come down? One more invitation. If not, that's perfectly fine. We are at time, but I am going to ask this student to have the last word, and I am going to ask you to introduce yourself and tell us where you're a student and whatever you want to tell us, okay? Let me see.
Hi.
Here,
Hi, can you hear me? Okay, my name is LaToya Wells. I'm a junior at Pacific Lutheran University. I am not impressed that I am the only one here. So I just want to say I am blessed to be here. I'm learning a lot. I'm not from Washington. I'm from Washington, D.C. I also say I do advocate for school nursing. I grew up in South Carolina. I had a school nurse. Is one of the reasons I want to be a nurse today. I would like to say that a lot of people I talk to in Washington, in this state, I come all the way from Puyallup, Washington. Do some of y'all know where that is? Okay. So a lot of students, high school students, middle school students, elementary school students, they don't know what a nurse does. I would like nursing to be more visible to that population. If this committee can maybe get a column in Teen Magazine. So I would like to just talk on the visibility. I know you guys touch very lightly on the shortage of nursing, and excuse me, I do not like public speaking, so this is a big deal for me. Please, please, please look at those populations, because I think they would have a great interest in being a nurse, but it's not seen as a valuable profession. And so if you guys could tackle that in the next 10 years, I'll be happy. And call, maybe I can get an internship with informatics. Okay, but thank you so much for coming and sharing all of this, because in school we get very task-oriented, and it's very stressful, as all nursing students know, and we would like to be invited to things like this. Okay, thanks.
Okay. We are at time. You heard the last word. Thank you so much for being here. Thank you for our live webcast audience. And stick with us. The report will be released at the end of 2020. We hope you'll look forward to it and you'll use all the recommendations. And bye, everyone.